Hello and welcome to the Ilene Silverman Show. I'm your host Ilene, and on this week's program, our guest Brendan Shortley provides perspective on the status of healthcare in our community, the 30-year plus history of Helping Hands Medical Clinic, providing free healthcare to our poor population, and how we as a community can make a difference. Stay with us. We'll be right back. Welcome back. Thanks for joining us for our program. I'm delighted to introduce my guest, Brendan Shortley, Executive Director, Helping Hands Medical Clinic, Chair, County Commissioners Healthcare Advisory Board, and co-founder, Grace Empowerment Center. And Brendan, it's wonderful to have you here.
I'm glad to be here.
Thank you. Thank you. We've known each other so many years. We've talked about your being a guest on the Ilene Silverman Show, and I've followed all the wonderful things you have and continue to do as part of this community. So it's just a real privilege to be able to have you.
Well, it's a privilege to be here, Ilene. I've obviously followed you for years, and all the different people have told me I need to get on this show, and I finally have gotten around to it after all these years.
See, it's a good time. It's a good time. And with all the emails we've exchanged, I have to say, your quote from the bottom is, "Live a long, good life, but most importantly, give back to the world as best you can." And what a wonderful statement. And it expresses you and all that you do, along with many people I know.
I appreciate that, and it's essentially, it seems corny to some people perhaps, but I feel it's a mantra to live by, and it puts gas in my spiritual tank and helps me keep going.
Yes, and you have a lot to accomplish. And homelessness is something that you have addressed in all your many years. And help us understand, well, in this conversation we're having, we hope to understand more about you and what is that passion that drives you, and to understand our community, where you co-founded Grace, then Marketplace in 2013. Homelessness has gone through several metamorphoses, and you have told me now things are a little more positive. So help us understand from this community's perspective.
Absolutely, Ilene. Yeah, it's a wonderful story. It's a feel-good story for this community, and it's something I hope spreads throughout the country. But we are fortunate to be in the minority of cities and communities that have actually managed to drastically reduce homelessness. And for those who know the history, homelessness peaked in 2013, about 2012, and at about over 2,000 homeless in our community. And we're at a desperation point perhaps, because we had made, as a community, the Model to End Homelessness was a 10-year plan that we were in the middle of, and we were not making much headway.
Right.
And so we found, in the county and the city both all together with us being the Coalition for the Homeless and Hungry, which at the time being chairman of that, they came to us with an offer of opening up a center for the homeless, an empowerment center. And the state had abandoned, if for lack of a better term, the prison up in the northeast part of town.
Right.
But before that was even available, we were looking for locations. We didn't decide on that at the beginning, and we were wanting to go downtown at first. And of course, certain factions of our community were resistant to that.
That met with some resistance. You're helping me remember all of this. Yes.
You know, and not to go there too far into that
No.
delving story, but the point is, I think we found a location where everybody from all sides of the community, all sides of the political spectrum, could all agree on, because it accomplished many different purposes. We, of course, you know, I'm not the first person to say this, and I'm not going to be the person who excuses away all activities and actions of the homeless. And I think them all congregating downtown can be, you know, a little invasive on other different activities.
Exactly.
So the businessmen came to us with that, you know, issue.
Right.
So they were behind the idea of opening up somewhere else where they could go and be empowered and be helped. And let's face it, we want to give them services and give them abilities to move on and move up in life.
Exactly.
And that's sort of my, maybe controversial, and I may be not the person you would think that would say this, but I believe in helping those who help themselves. I believe in helping the ones who want to get a job or to improve or to make a resume or to do something
right.
positive.
And you want to give them the tools to do that with, so they don't stay
Exactly.
in the unfortunate circumstance of which they are.
Absolutely. And just to, long story short, they were not able to find a place that could give them all those things. So we were jumping to open up a place like that could do all those things. And it was in stages, and nobody remembers that we didn't know if anybody would come out there all the way to the airport.
Oh yeah, I remember that.
That was a long way to go.
I remember being there for the ribbon cutting.
Yes, and we're like, boy, that's a long way for somebody who doesn't have transportation to get out to.
How could we make that work?
But I sat in Fred Murray's, assistant city manager's office and talked to him about how, can we get some bus passes? And we got over 1,000 or more bus passes, and distributed those among the homeless. Actually, we got 2,000. And we found that they actually used the system. For the first time, they're actually getting around more easily. Annual passes, they get in every day, all day. And of course, people riding their bikes made it out there too.
Right.
So when we first opened, we literally didn't know if 2 people would show up. And now we have 300 meals we're serving every day. Hundreds of people coming in and out of there, and always at capacity.
It has proven itself since 2013.
Yes. Thank goodness.
It is, yes.
So to answer
yes.
I unfortunately never answered your original question, but I'm so
okay.
excited about these.
I know, it's okay.
So
we're going to take a quick break,
okay.
but I want you to hold that thought because
Okay.
we're going to come back and discuss it more thoroughly.
Sounds good.
Stay with us. We'll be right back. We're back talking with Brendan Shortley, Executive Director, Helping Hands Medical Clinic. And Brendan, fascinating what you were talking to us about in our first segment about grace and homelessness in this community, and really explaining it thoroughly. What do you see as the state now? Where are we now?
Well, the end of that feel-good story, the feel-good part, is that once that homeless empowerment center started in 2013, our peak homeless was 2,000, and since then it has decreased every year since then, and now we're down around between 400 and 500, which is incredibly impressive for our community. It's a testament to all the hundreds of people who have worked behind the scenes to make it happen.
All those volunteers, all the people that care.
And we're all volunteers, all these coalitions for the homeless and hungry, we're all volunteers and still are,
Well, then one of the crowning achievements, certainly of your career and many, goes back to 1989 and the beginning of Helping Hands Medical Clinic. And so what was the impetus for that, and how did it evolve into what it is now?
Well, you're getting me excited again, Ilene.
Okay, good.
But that's so to tell you that story, of course, I came up to school in about 3 years before that in Gainesville, first time at this in this community, and I started doing this kind of thing down in South Florida. When I was a little kid, I would make my parents drive me to Miami or wherever the homeless, concentrations were highest.
Right.
And I would just give them things, just hand out materials, because of course when I was, a little boy, I didn't obviously have much medical training at the time. But when I came to UF and became an adult, I noticed that there were no clinics for the homeless or the poor. And people don't realize half of our clients are just poor people in apartments that just can't afford healthcare.
Any kind of health care. We were talking earlier, it just frightens me.
Mm-hmm.
I mean, it's hard if you can afford health care, if you have a home, if you have creature comforts. It's hard to even think of what people face.
Exactly. I mean, what are you going to do? You're going to pay your electric bill, or are you going to buy food, or are you going to pay for health care? Well, you're going to choose the food and the electric bill. And then you don't have money left, so then
then you're forced to an emergency room eventually.
Exactly.
But by then things have gone on. Well, these things have been discussed, but you're someone who said, I can do something about it.
Right. So we were astonished to see that there were no clinics for anybody of any kind of poor means. So we got together with a group of about 5 or 6 of us, a couple nurse practitioners, and a couple students, people just wanted to help. And we got together at the Salvation Army dining room. We didn't have enough money to
Right,
have a
even have
building.
space.
So they were kind enough to, after their dinner hour, would let us just open up the tables at the dining room,
Right.
and just use them as exam tables and put up little curtains, that were very makeshift, and just give health care and just do vitals and prescribe. You can prescribe as a doctor. You can be in a kitchen and prescribe somebody something. You don't have to be in an office.
No.
So we took advantage of that, the state licensing, to be able to prescribe and send them to the pharmacy. And then we started getting a few donations. We would celebrate if we got a check for $40, and now we're at a 6-figure budget, and now we have over 100 volunteers in our current situation.
And you've gone from location to location, and the list of what you do is enormous.
Right. We do, of course, medical care, but we
Right.
do supplies. We do psychiatric treatment, which we can get into. And
Right.
the only clinic in town that still
That
does
is doing
psychiatric
that.
care.
Exactly.
To our degree, with full on-board medications and everything.
And the need for dental care is so enormous.
Absolutely.
And so important.
Yeah, we do oral health, eye care, even Eastern medicine, massage, acupuncture.
Right.
We give out food and supplies, of course, too. It's obvious that they need those things too, and we've done that since our inception.
I mean, you even extended, I see, where people may need clothing and other necessities of life.
Exactly.
You invite those donations. You stay with people. You follow them. It's not just, here you are, let me give you a Band-Aid and move you on.
Right.
You were invested in their lives to make them better.
We are, and I can tell a million stories about people we followed over literally decades, psychiatrically too. And we've improved their state of being, and we've actually helped them get jobs. There are people now who are our former homeless clients who are now in Silicon Valley working for a Fortune 500 company.
Oh, it's amazing.
Yeah.
And it must make your heart soar. You
Oh,
must
it's the best.
feel so proud, so good. All the volunteers. It's the motivating factor. It keeps you going.
It's right. It puts that gas back in the spiritual tank.
Okay, right. We're going to take another quick break. Stay with us. We'll be right back. We're talking about Helping Hands Medical Clinic. And Brendan, we were just starting to talk about the clinic addressing mental health issues and being the only one of its kind in this community to do so. And yet the need is so great.
Yes.
And sometimes so misunderstood still.
Absolutely. And in fairness to some of the other clinics that we've helped mentor, they do some level of counseling in a few areas, but we're the only ones that do a full spectrum of mental health and medications on board, on site, which if you can track the place that you have to go to get medications, and then go to this institution for this service, and then you have to
And if you
consolidate.
don't have transportation, that's almost insurmountable.
Right.
I mean, it's just, you can't think these things out.
And they've done studies
You
that
can't do
prove
it.
that you'll never get them to go to that next hurdle and the next hurdle and
It's
the
just
next.
too enormous a hurdle.
Very true. So we've contracted years ago, a decade or two ago, with the University of Florida, Department of Psychiatry, College of Medicine, to offer their residents and their attending physicians, psychiatrists, into our clinic every week. We do it, where they give counseling and do the full spectrum of psychiatric treatment, but mental health too. We're all about that too. We're not just going to give them a pill. And that's the great thing about that I love about our clinic, because a lot of people nowadays in Western medicine is all about treat 'em and street 'em.
Right.
We have followed people over decades, the same patients that we keep maintained and keep on the right track. The psychiatrists have told me the right term is longitudinally. We're following them over time, and we have the same client that will just keep maintained. And they will eventually thereby be able to go to that next level and find the job, find the place in society.
And pull themselves out.
Exactly.
Yes.
And that's the only way it works.
Well, and we talk about depression.
Exactly.
Do you find, and so much, you've talked about the support groups, so much that people have to cope with, whether they're living on the street, women, sexual abuse,
Yes.
the support groups you're offering, and all of that ties into depression and mental illness and ability to cope, and
Absolutely, and I failed
then you
to
throw COVID in on top of that.
right, and I failed to mention that we do support groups, and we have people in these groups. The Women's Empowerment Program we do, we're very
Right.
very proud of. We just started about a handful of years ago. They will tell us the stories of sexual abuse because let's face it, women are much more vulnerable on the street,
Exactly.
and they will experience these abuses physically and mentally, and they need to tell somebody, and they don't tell authorities, and they will tell us.
You're a safe place,
Exactly.
and they know you're not judgmental.
Yes, and they come
And-
to tears. We come to tears. Everybody cries almost every week, but it's the best cathartic type of thing,
It's healing.
and we help them get better.
And you offer showers and just, like I think just that simple thing. It
Exactly.
shows respect and gives people their humanity back.
Right, we call it dignity, and the humanity is just exactly
Their
the same.
dignity.
Exactly.
And we were saying that within this month it's mental illness awareness, depression, and have you seen that COVID has caused more of these problems, or
I did
they
back when it
increase?
started, because now we're looking in retrospect on how
Right.
it affected our community, because it peaked, in the middle of 2020, peaked again in August of 2021.
Exactly.
And people didn't want to associate with other people, and that's a mental issue. The fact that we don't socialize or didn't as much, and we had to deal with that too. It caused a greater amount of depression. It really did, and we saw that in our patients. And so that has been overcome now. We are on the good side of it now, seeing that they are coming back. Our numbers are increasing now, and
People
now
are
we're
able to come back, feel more comfortable masking or whatever it takes, but
yes.
more association.
It's a feel-good story in
and
itself.
Yes, and people need people.
Exactly.
We need each other. We're humans. That's
Yeah.
part of what and what makes us thrive.
Exactly. No matter how
And-
much we
and
go online.
kindness. Yes. Now we need that human connection over and
Absolutely.
over again. And speaking of connecting, so how can the community help out?
Well, if you Google Helping Hands Clinic Gainesville, make sure you put
Okay,
Gainesville
okay,
in.
yeah.
And it's not the pet clinic, which there is a Helping
Okay,
Hands pet.
yeah.
It's the
It's
human
not-
clinic. There's a way you can find out all about us on the website, and
All right.
you gave me permission a few minutes ago to be
Please.
able to mention the donate button right on the cover page. You can donate anytime, and
I mean, that's what you survive by donations.
exactly, we're not state fund. I mean, we used to get a little state funds in a county, and we are supported by the county and the city with very nice grants. But that makes up less than half of our funding.
Right.
Most of it's
You
just
need-
private donors saying, "Hey,
We
let me
know
write
you're
you a
here,
check."
and we care.
Exactly.
That's what it's all about.
Absolutely.
We're going to take another quick break. Stay with us. We'll be right back. We're back talking with Brendan shortly. And Brendan, when we talk about healthcare in this community, why is it important for everyone to have good healthcare? Could we just have people out there who say, I'm taking care of me and my family and that's enough? Or is it enough?
Well, we've learned over the years and through studies actually, nationally and globally, that a rising tide raises all boats, and that especially applies to healthcare. If we think about it, our least fortunate among us cannot even try to think about, especially with oral health, getting a job, going for an interview, trying to integrate back into society, unless they are somewhat healthy. And that goes for
Exactly.
oral health and mental health and physical health.
Well, oral health, it creates that first impression.
Exactly. Imagine if you have a toothache that you're dealing with every hour of every day. Are you
You're
going to
in
be
pain.
very easy to get along with, number
No.
one? Number two, to be able to interview properly. It just leads to everything. And that's part of what we do. And you were asking me about this during the break, about the Healthcare Advisory Board for the county.
Exactly.
And
What are the issues you address?
well, the county commissioners, to their infinite wisdom, many, many years ago,
Right.
in the dim ages when bear and bison swarmed the prairie, and Gainesville was just a notion, they said, let's have advisory boards for every kind of concept that we need to address. And healthcare is certainly our biggest board, by the way, of all the commissioners'
Of all
boards.
them.
And we have seats on there given to U of Health Shans, physicians, nurses, Acorn Clinic, Helping Hands. I'm the chairman, so I guess I count.
Right, but
We're-
bringing all of these groups together to partner together.
Exactly, and there's so much expertise at the table, and we deal with all the issues. We deal with the tobacco cessation, the
Right, a program you offered, Helping Hands.
correct, and the Tobacco 21 programs, the needle exchange, that's very controversial, but we deal with, COVID, of course, was an issue we dealt with for a long time in the past, and everything we do as a community when it comes to our programs, our choices programs, our dental programs,
Right.
our health department has a seat, and so we try to accomplish and conquer these issues that are never going to go away.
No, but that with everyone working together, you're much more effective. And you don't duplicate services,
yes.
but you complement each other.
Exactly. And we try to deal with more of volunteer-based organizations like the Safety Net Collaborative, which is comprised of all the frontline clinics and organizations that deal with the homeless and the hungry. I keep mentioning that our clinic is only half homeless. It's half just poor people trying to make it.
Right.
When we're all just a step away. We have electricians, we have former carpenters that helped to build half of the town of Tioga resident buildings in the houses, and now they're in a tent because they had one bump in the road where they couldn't pay a bill, or they had a bad divorce or whatever, and then
they don't have a safety net, and then boom.
And then they're out on the street.
So then you look at them and you think how very little could separate you from that person, from that unfortunate bump in your own road.
Exactly.
And that should help us all understand that as a community, we're only as good as the other person. We
Right.
all have to have a good education, good health care, food and housing, or else we are not a good community at all.
We're as good as our lowest denominator, and I think we've improved that denominator significantly. We should be very proud of ourselves as
That's
a community.
good.
We've done great strides. There's much more to do.
Oh
But-
yes, I understand.
Yeah.
And we're happy we have leaders like you. I mean, we're
Oh.
proud that we do. It makes a difference. And we were talking about ways of helping and assisting Helping Hands Medical Clinic, and you said you have a opportunity right now. Just share that with us.
Oh yes, every year we do a match challenge where a very big generous benefactor agrees that every dollar that's donated, up to about, I think it's $50,000 per donor, he will match it. Doesn't matter how much anybody donates. But he will match it, no matter how little you give, and we get personal checks and PayPal and clicking on the website all the time, and that's more than half our budget. It's just people deciding, hey, let's give a little bit.
This is important. I'm going to do this.
Every little bit
Okay.
helps.
Yes. Now, I understand and I appreciate all the knowledge you have brought here to our show and continue to give to our community. And I know that you would be the first to say the volunteers that work with you are the people that you sing their praises.
Make it all go. We wouldn't do a thing without them. No
I know.
no doubt.
And the stories that you have, I know we don't have enough time for all of them, but the stories of everyone that has received help from the clinic and other available resources here, that's just what motivates you,
It does.
makes the world different.
It keeps me going.
Well, I thank you for that.
Thank you.
We're a better place because of it.
Oh, stop. I'm going to hide behind the chair now that I'm embarrassed.
Thank you, Brendan.
Thank you.
And I'm so glad that you tuned in, and I hope you will join us next week. Take care.